So this is the evaluation of our plan after we did the total knee using calibered method of kinematic alignment. We have to do the cuts just equal to the thickness of the implant. We used evolution of Life Medics, which is a distal posterior thicknesses that are different. So for the distal thicknesses, the thickness of the implant is 9 millimeter, while for the posterior it is 11 millimeter, for the femur size 6. So because we have medial cartilage defect of 2 millimeter on the distal part of the femur, we cut 6 millimeter measured from the defect by the caliber, and we add 1 millimeter of the saw surf, so the final cut will be 7 millimeter. If you add the 2 millimeter of the defect, it will equal to 9 millimeter, which is the thickness of the distal part of the implant medial side. On the lateral side, which is normal, we cut 8 millimeters, and if you add the 1 millimeter of the surf of the saw, it results in 9, which is just equal to the thickness of the implant. The same for the posterior cuts. We cut 10 millimeter from both sides because there is no worn part in the distal and the posterior condyle. So after we add the 10 millimeter to the 1 millimeter surf, it results in 11 millimeter in both sides, medial and lateral. Again, there was no defect in the posterior part of the implant, and this is the usual. The defect is usually in the distal part. Coming to the tibial side, we measure the cut 9 millimeter from both sides, medial and lateral, from the intact part of the cartilage, and we evaluated it from the defective side because the tibia has no significant cartilage loss. For the tibial component, metal, it's about 10 millimeter of thickness. So on the medial side, we cut 7 millimeter from the defective side if we measure, or 9 millimeter if we measure it from the normal side, just as the lateral one. So with the adding again of the surf of the saw, it is 8 millimeter from the defect, 9 millimeter if you add 2 millimeter to 10 millimeter from the normal side medially, and the lateral side is normal, so we cut only 10 millimeter from the highest point. So we cut the tibia to its native anatomy, and this is the kinematic alignment. Thank you.